It is a pleasure to be here. I am excited to talk to you guys today about this information, and we are going to cover quite a bit of information, and we're going to try to do it inside this hour we've got. Like she said, my name is Spencer Harmon. I am with CAPTRUST, and CAPTRUST is the independent financial advisory firm that works on your Michigan Catholic Conference 403B plan. To give you an idea of what we're going to be discussing today, this presentation is going to outline some of the steps needed to prepare for retirement, especially as you are approaching retirement. And the decisions that you make right now are going to take a profound effect on how that retirement picture is going to look. So hopefully you'll pick up some pointers that'll help you understand your options. A lot of times when we meet with participants, they're not quite sure what questions to ask. If you haven't delved into this information, might be a little bit daunting. But as everybody understands, beginnings are a little bit tough, but as you get into the process, it gets easier and the outcome will be a lot better than what you expected. So most importantly, though, CAPTRUST is here to help you. You can schedule an appointment with CAPTRUST advisors by going to captrustadvice.com, or like Ricky said, you can call directly to our advice desk at 800-967-9948. And I just want to foot stomp the announcement of those virtual one-on-ones. They are on May 9th, 10th, and 11th. Like she said, if you look in the chat section, there is a link there, and you can click on that link and set up an appointment that way, or you can use the handout in the handout section. Okay, let's go ahead and jump right in here. So first things first, of course, we have to go through a disclaimer, but just understand, I'm not going to read all the way through it. I don't want to put you to sleep just as we get going and get started here, but understand that number one, any discussion you have with CAPTRUST advisors is 100% confidential. All investments have differing degrees of risk associated with them. We understand that everyone has different goals and unique needs, and so after you listen to this presentation, you'll probably have a better understanding of the investments and risks involved with those investments. But just so you know, like all the other information that we're going to be covering in this presentation, CAPTRUST Advisors is here to help you make some of these decisions, but we do not offer legal, tax, or accounting advice. Okay, so that's the main takeaway. Let's go ahead and look at the agenda for today. Although most of our discussion will focus on the financial considerations of retirement, we will also provide a general overview on Social Security and Medicare and when to consider taking these benefits. We'll talk about healthcare, some of the sources of income during retirement, and asset allocation. And then we'll finish up with preparatory steps for retirement and some contact information. All right, like I said, let's get into the personal retirement planning part of this. Retirement planning can take a lot of different forms, and it really depends on the person. It can be as simple as working through it. For one person, it may be just writing down your inflows and outflows, and for others, it's a much more elaborate financial plan. It's important to focus on what your end game is and how to get there. Don't forget, it's not just about financial planning. Planning for retirement also includes knowing what you're going to do with your life. That it could be 20 to even 30 years of time. So it's a long time. So what this simply means is that we've been working for most of our lives. Some of you have been working since you were a teenager, and now you're going on to that next chapter in your life, and it can take some time for this new chapter to start coming together. But like everything in life, you'll need to have a plan and make sure you focus on that plan so that you can attain some goals. As you get closer to retirement, there are some things you should consider when you're in your 50s and your 60s. While you're in your 50s, you'll want to eliminate debt as much as possible and maximize your savings. In your 60s, you'll look at your income needs and Social Security and Medicare. You'll start thinking about creating a will or trust. The point I want to make is that there's some planning involved, and if you need help with that or how to get started in that process, please reach out to CAPTRUST, and we'd be happy to walk you through it. Now, the retirement landscape has changed. It used to be that employers would take it upon themselves to pay for employees' retirements, and that worked really well for our grandparents and our great-grandparents, but it was very expensive on the company, and so that has changed quite a bit. Now that responsibility to save really has shifted over to you as an individual. So it's extremely important that you are saving for retirement as soon as you begin working. If you are later in your career, make sure that you're contributing as much as you possibly can in preparation for this time. It's no secret that Social Security is an underfunded system. We really can't rely on that income alone. Nobody really knows what that's going to look like in 20 years or even 10 years for that matter. And people are living longer. Healthy aging and longevity is another reason we really need to save diligently. It just means that you're going to have to provide for yourself for a longer amount of time during retirement. All right, inflation. Inflation is a strong consideration when you're talking about retirement. The cost of goods and services increasing is what inflation is, and they are increasing all the time. And this increase weakens the purchasing power of the dollar. It can be difficult to keep up with those rising costs if your income isn't growing at a similar rate, at least. And then last on this list is healthcare. Healthcare costs are continuing to increase and are expanding faster than inflation is. And if you weren't paying attention last year, in 2022, inflation was absolutely out of control, and so it's hard to believe. But if you look at the broad picture, healthcare actually is increasing faster. So it's imperative that we're saving as much and as soon as we can. All right, now here you're going to see some common income sources for today's retirees, and what I want you to be thinking about during this is what are going to be your sources of income during retirement? How much of your needs are those income sources going to cover? Part of it could be Social Security, which was never really meant to cover everything anyway, and you may decide to keep working. Some people really plan to actually keep working during retirement, whether it's full-time or part-time, and there are limitations on how much you can make and compared to what you can receive from Social Security, and we're going to go over that here in a little later. But retirement savings really is what most people are going to have to need to rely on during that retirement time frame. So it's important that we save diligently. If you do need help creating a budget or starting to save or debt management, anything like that, please give CAPTRUST a call so we can help walk you through it. All right, let's talk about Social Security benefits. There are always a lot of questions about Social Security. It's something we get pretty common. When to start taking it? Can I share it with a non-working spouse? How do my benefits change if I wait until later to take it? So there's all kinds of questions like that, and we're going to cover some of these. So Social Security is a monthly benefit, and it is paid until you pass away. The benefit is calculated based on your highest 35 years worth of earnings. To qualify for Social Security, you need to be at least 62 years old and have been working for at least 10 years. Waiting until you are at the full retirement age, which the Social Security uses that term quite a bit, and they abbreviate it as FRA, so the full retirement age, FRA, that is between the ages of 66 and 67, depending on when you were born. So if you wait until you are at the full retirement age, that will result in a higher monthly benefit for you. If you can delay collecting your benefit until the age of 70, there are even advantages to that. But the benefits don't increase if you wait longer than that. So 70 is the longest you can wait for the amount to actually increase. We'll look at an example of this later on in the presentation. Okay, so the year you were born is the qualifier to determine what your full retirement age is. If you look at this chart, if you were born, I know most of you are going to look at this slide while you're listening to me. So you want to see if you're eligible to receive the full retirement benefit. If you can wait until your full retirement age to start taking Social Security, you'll receive the highest monthly benefit. And this is a great slide to be able to determine what that is. All right, now you will have choices as to when you want to start receiving the benefits. These factors can all come into play when deciding when and how you'll want to take those. So something to remember is that when you start receiving the benefit, if you take it early, it will be a reduced amount. The amount you receive does increase as you get older and is based on the current cost of living. It does not change much from year to year, so waiting may be something you may want to consider if it's an option. This is the type of conversation that would be really helpful if you were to reach out to CAPTRUST and have this conversation with you. What we do is we look at the amount you have saved for retirement, we compare that to how much you'll be getting as a Social Security benefit, and then we look at time frame and things like that, and we help you to do a projection to see if it's better for you to start taking it early or if it's better for you to wait and take it later on. All right, so if you think you have a longevity during retirement, you'll want to consider how taking your Social Security might impact you. I suggest you go to ssa.gov. Okay, that's www.ssa.gov. SSA is just an abbreviation for Social Security Administration. ssa.gov. Go to that website to look at your personal situation. And that information will look something like this. This slideshow shows the reduced amount at age 62, and then you can see the full amount at full retirement age, or FRA, and then what it would look like at age 70. Remember, Social Security benefits continue to increase until you reach the age of 70. All right, some of you may decide to continue working part-time in your early years of retirement. There are income restrictions on working while you're receiving certain Social Security benefits. For this year, if you are under FRA, the full retirement age when you retire, then the earnings, anything over $21,240 per year, for every $2 over that limit, $1 is withheld from your Social Security pay. Okay, so then if you retire the year you reach full retirement age, so if you wait until that FRA, and your earnings are over $56,520 per year, then for every $3 over that limit, $1 is withheld until the month you reach the actual full retirement age. And the reason why is because once you do reach the full retirement age, there are no restrictions. So if you want to keep working, whether it's full-time, part-time, you could be making $800,000 a year. It makes no difference. You still qualify to get the full Social Security income. Now, when considering which earnings will potentially reduce your Social Security benefits, remember that it is earned income that reduces your benefits. So passive income, like interest or dividends or benefits from a retirement plan, or something like real estate. So if you have a rental property and you're getting income from that, that is not considered earned income. So because those are not earned income, they do not go against what you receive for your Social Security benefit. Another common question is around the taxation of Social Security benefits. Social Security income is generally taxable at the federal level. Though whether or not you have to pay taxes on your Social Security benefits actually depends on your income level. So if you have other sources of retirement income, like say you were taking withdrawals from a 401k, or you have a part-time job, then you should expect to pay some income taxes on your Social Security benefits. If you rely exclusively on those Social Security checks, though, you probably won't pay taxes on your benefits. State taxes on Social Security, on the other hand, vary from state to state. So regardless, it can be helpful to work with a financial advisor or tax advisor who can help you understand how these different sources of retirement income are taxed. So make sure that you are setting up appointments, make sure that you're talking to a tax advisor. These are critical issues and they will absolutely impact you during retirement. This is something you do not want to learn while you are in retirement. You want to learn this beforehand so that you can set yourself up for success and know what your situation is going to be. It'll give you peace of mind. All right. What we have described here is a brief overview of some of the most commonly asked questions about Social Security, and there's also a tremendous amount of information on the new Social Security website. Again, that's www.ssa.gov. I highly recommend that you go to the website and register. This will give you access to your personal information. You want to register there, not just go and look at the information, and you can register early. If you're in your 50s, go ahead and go register. Doesn't hurt anything. I'm 50 years old and I am registered. I want to watch that and see it ahead of time. So you don't want to have any surprises. You want to know what's coming. On that site, the red arrow directs you to the My Social Security link so that you can establish your account. So follow that link and it'll be easy for you to set up. It's a pretty easy process. And then of course you can always call CAPTRUST or the Social Security office and get more information. Okay, let's move on and talk about healthcare during retirement. There's all kinds of different ways to deal with healthcare, of course. And as a person ages, there's potential of increased healthcare costs. It's important to realize that the healthcare costs can drain retirement savings. If you're looking at the slide, Fidelity's study estimates that the average couple at age 65 will spend $315,000 during retirement years to cover their out-of-pocket healthcare costs. And that is not including long-term care. So who is eligible for Medicare? Let's get into Medicare. What are some of the things to consider? A person who is 65 years of age is eligible for Medicare. Initial enrollment period begins 3 months before the age of 65 and then goes to 3 months after you turn 65. At age 65 or older, you are generally eligible to receive Medicare Part A, which is the hospital portion of the insurance. And then Medicare Part B, which is the medical insurance. If you are a United States citizen or a permanent legal resident who has lived in the US for at least 5 years in a row. So at 65, you are qualified for both Part A, the hospital insurance, and Part B, the medical insurance, if you are a citizen or a permanent legal resident who has been here for at least 5 years in a row. If you are on disability, remember that you have to be on disability for 24 months before getting Medicare. If you have ALS or a permanent kidney failure, you are eligible immediately. Remember, Part A, which is hospitalization, is free, and you should sign up even if you are still covered by your employer. You want to avoid higher premiums for not signing up, so I recommend signing up. All right, again, Medicare starts at the age of 65. It's a good idea to start filling out your enrollment questionnaire about 3 months before your coverage starts. Keep in mind you can still apply even if you are working and qualify for coverage from your employer. If you're in this situation, it's a good idea to check with your benefits provider to understand how those two plans affect each other, because most of the time they work together. Lastly, if you are contributing to an HSA and you're close to the age of 65, you'll need to be aware of the date at which you are required to stop contributing to that HSA. HSAs do have very specific limitations to them, and you don't want to get penalties. Okay, Medicare has varying levels of benefits. The most common are found under Medicare Parts A, B, and D, and we will now discuss the various component details. So Part A, remember, I was talking about how that is the hospital insurance, and that covers most inpatient hospital expenses. Then you've got Part B. This is supplemental medical insurance and covers about 80% of the doctor bills and outpatient expenses. There are restrictions involved in that. So again, the best thing to do is to be ahead of this process. Make sure that you are looking into it beforehand so that there are no surprises. And then you've got Part D. Part D is the Medicare prescription drug portion, and it's designed to cover major portion of drug expenses. All right, let's talk about contingencies. So what if you forget to enroll? What if you are covered under an employer plan and you don't enroll on time? If you do, you could be granted a special enrollment period. You just have to make sure that you enroll while you and your spouse are working and covered by a group plan under that employer. Again, I want to emphasize this one because this is one that gets people in trouble all the time. So make sure that you enroll while you and or your spouse are working. You want to be enrolling while you are still covered by a group plan from an employer. You do also have an 8-month special enrollment period that starts the month after the employment ends or the group health plan insurance based on their current employer ends. So whichever happens first. Okay, I'll say that again as well. 8-month, it's an 8-month special enrollment period that starts the month after the employment ends or the group health plan insurance based on your current employer ends, whichever of those happens first. All right, keep in mind that COBRA and retiree health plans are not considered coverage based on a current employment. So those will not qualify for the special enrollment periods. Okay, so it has to be an employer-sponsored insurance plan that you're covered by. It's got to be that so that you qualify for that special enrollment period. All right, let me just recap just to make sure. To avoid any tax penalties, stop contributing to your HSA at least 6 months before you apply for Medicare. Okay, that one's a critical one. You don't want to get the penalty for that. If you are covered under an employer plan, do not end up enrolling on time, you could be granted a special enrollment period as long as you enroll while you or your spouse are working and you are covered by a group health plan through your employer. And then also you have that 8-month special enrollment period to sign up that starts the month after the employment ends or the group insurance plan based on the current employer ends, whichever happens first. I did not say that smooth. Let me say that again. It's the 8-month special enrollment period, and it starts the month after the employment ends or the time that health insurance plan based on your current employment ends, whichever happens first. Okay. All right. Now, many Medicare recipients choose to purchase Medicare Advantage plans or Part C. Medicare Advantage combines benefits received through Medicare Parts B and D. This is again supplemental. Those receiving Medicare Part B are not purchasing the Medicare Advantage plan may find it advisable to acquire a Medigap policy or Medicare supplement policy. Medigap policies are intended to provide benefits over and above what is provided through Part B. Okay. This is one of those items where there's just so much to go over and there's all kinds of nuances to this. So please look into it ahead of time. Give CAPTRUST a call so we can walk through it with you. But there's just a lot to this, and we want to make sure that you know that you need to have a heads up on this before it's time to actually enroll. Give yourself time to digest the information and understand how it works so that you have a working knowledge of this as you enter into this time frame of your life. All right, now when you're thinking about all the different options, things can get a little confusing. Remember that you have 3 basic options, okay? You've got Medicare Parts A, B, and D, and that's the original portion. Then you've got the original plus Medigap. So Medicare Parts A, B, and D, and then you've got a Medigap. And then you've got Advantage, which is Medicare Part C. So these are 3 different options you have that you can choose from. All right, now if you retire prior to age 65, you may still need healthcare coverage to help fill the gap prior to the time that you're eligible for Medicare. In most cases, HSAs cannot be used for private healthcare insurance premiums. However, there are a couple of allowances. Paying for healthcare coverage purchased through an employer-sponsored plan under COBRA, and paying premiums while receiving unemployment compensation. Those are a couple of allowances that allow you to use HSA. Now, although this isn't true at any age, it is of greater significance if you lose your job or decide to stop working prior to turning the age 65. You can use your HSA to pay certain Medicare expenses, including premiums for Part B and Part D prescription drug coverage, but not supplemental. So the Medigap policy premiums, you cannot use HSA to pay for that. For retirees over 65 who have employer-sponsored health coverage, HSAs can be used to pay your share of those costs as well. Your HSA can be used to cover part of the cost for a tax-qualified long-term care insurance policy. And actually, this can be done at any age, but the amount you can use increases as you get older. Now, COBRA, the Consolidated Omnibus Budget Reconciliation Act, COBRA. This gives workers and their families who lose their health benefits the right to choose to continue group health benefits provided by their group health plan. There are limitations to COBRA, like the time periods for coverage. So let me say that again. There are limitations to COBRA, like the time periods that are up for coverage. Whether or not you voluntarily lose your job, and COBRA coverage can be very expensive. So keep that in mind. COBRA is a great option if you don't have any other options, but COBRA is very expensive and there are limitations to the time periods of the coverage. All right, then spousal plans. If you retired early, but your spouse is still working, you may want coverage under their plan. If that's not an option, you may want to look into public marketplace. Losing your current coverage would create a special enrollment period, or you may qualify for federal help. And lastly, there's always the option of private insurance. Private insurance is probably the most expensive, though. All right, don't wait to get familiar with Medicare's website. The earlier you get familiar with this, the less headache in the long run. You can learn more about Medicare by visiting the website at medicare.gov. This is another one, just like ssa.gov. Please don't wait to get familiar with this. Go on their website, check it out, look at the qualifiers, get familiar with some of the limitations, learn about how this works, talk to a professional, and get a clear understanding of what options you have beforehand. Okay, let's look at HSAs. This may not apply to all of you, but let me give you a simple definition and the amount that you can contribute, okay? So this is, it's a tax-preferred savings account where money is set aside to pay for qualified medical expenses and prescription drugs tax-free. I can't stress this one enough. If you have a health savings account, this can be a giant benefit for you. The annual maximum for 2023 for a single individual that you can contribute is $3,850. For married couples, that's $7,750. And then there is a catch-up contribution for anyone over the age of 55 of $1,000 extra per year. And all these limits do include employer contributions. So if your employer is contributing, just understand that they go towards these limitations. It is also important to note that these accounts are individually owned and they are portable. Employer contributions are optional. Please be reminded, as I'm sure you have had discussions with your benefits department, that these accounts are required to be part of a high deductible health insurance plan. So you usually cannot qualify for these unless you are participating in a high deductible health insurance plan. Now, since the passage of the Affordable Care Act in March of 2010, it's also known as the Obamacare Act, so employers have started adopting HSAs as a part of their overall health insurance benefit program. HSAs have unique tax advantages, and these are realized if the individual holds an account balance when entering retirement. So the point we're making here is that you can take this HSA savings account with you into retirement and essentially use it as a tax-free source of money to pay for healthcare expenses, as long as those expenses are qualified expenses. They're a great way to save now for those medical expenses during retirement. If you've ever talked to somebody in retirement, you'd know that usually healthcare expenses make up the biggest expense during those years. Any distributions that you take from an HSA are tax-free as long as they are qualified medical expenses. Even retirement accounts don't have that advantage. This is a huge advantage to take it to use to your advantage. They do have some of the limitations. So for example, the annual maximum for a single person's contribution is $3,850, like I was saying in the previous slide. Again, if you are contributing to one and your insurance covers your spouse and other dependents, then you can also contribute up to the $7,750. So let me kind of reiterate that. The only way you can contribute that $7,750 is if your medical plan that you have through your work covers your spouse and your family as well. So if it covers them, if they are included in as dependents, then you can contribute the extra and do $7,750 to an HSA. Otherwise, if they are covered through their own work plan, and they do not have access to an HSA, but they are not covered through yours, you still cannot do the 7,750. The only way is if they are covered under your plan at your employer. Okay. It is also important to note that the contribution limits also include any employer contributions. I know we are repeating some information, but that is on purpose. We want to make sure that you understand these limitations. These plans do vary from state to state, so you want to be familiar with your state's rules, and you do not have to participate in just your states. You can use other states' HSAs. But usually there are advantages to using your current state's HSA accounts, and so make sure that you understand the differences as you're comparing from state to state. Another great advantage to HSAs is that once they get to a certain level, they are investable. And this just means that the monies that are in them can be invested, similar to an IRA. All right, let's take a look at the potential for triple tax savings with an HSA and what that would mean for you. So your tax-free savings are comprised of your employer's contributions and if applicable, your contributions and interest plus investment income. So there are three different sources there. There's your contributions, the interest plus the investment income, and your employer contribution. So those are all tax-free when you take the money out if you use it for qualifying expenses. It just means that you don't pay any taxes as you take that money out, and the money is invested with growth, nor do you pay taxes on the money that is taken out of the account, provided that the money is used to pay for healthcare expenses. So again, we're just foot stomping the exact same points over and over again. I understand we are repeating it quite a bit, but it's because we do get quite a lot of questions about HSAs and how they work in retirement. And the main points that you want to understand is that you can invest the money once it gets to a certain amount, and that changes from state to state, and that's why we're not identifying it. But once you get to a certain amount, you can invest that money. So any growth on that money, any contributions that you have made and the interest on those contributions, and any contributions that your employer has made and any interest on those, all of that combined, all of that is tax-free as long as you're using it for eligible expenses. All right, we are going to recap one more time. If your plan is to retire prior to age 65, you may still need healthcare coverage to fill the gap prior to the time that you're eligible for Medicare. In most cases, HSAs cannot be used for private health insurance premiums. So if you are planning on relying on that, make sure you understand that limitation. However, there are a couple allowances. Paying for healthcare coverage purchased through an employer-sponsored plan under COBRA, or 2, paying premiums while receiving unemployment compensation. You can use your HSA to pay certain Medicare expenses, including premiums for Part B and Part D, the prescription drug coverage, but not supplemental, which is Medigap policy premiums. For retirees over age 65 who have employer-sponsored health coverage, HSAs can be used to pay your share of those costs as well. All right, your HSA can be used to cover part of the cost for a tax-qualified long-term care insurance policy. Actually, this can also be done at any age, but the amount you can use increases as you get older. Okay, I think we have beat up HSAs enough. Let's talk about income during retirement. This chart shows us some simple goals to have in mind for your retirement savings account. If you're looking at the bar on the far right there, you've got a 10 above it and a 67 below it. At age 67, which could be the FRA, right, that full retirement age, so that you get your Social Security. Fidelity studies show that the average person would need to have 10 times what they make in 1 year saved up to maintain their standard of living. Then they broke it down by age to be considered on track. So if you are 50, Fidelity states that you should aim to have 6 times your annual salary saved. When you hit 55, you want to have 7 times your salary, and so on and so forth. And this is assuming that you need about 45% of your annual income during your working years for retirement. So that means whatever you're making now, about 45% of that's how much you're going to need during retirement per year. And that may or may not be true depending on your circumstances, but it's a great place to start. Now, this does not include pensions or Social Security, which was never really intended to cover everything. It only replaces about 30 to 40% of your income. So the idea there is you're adding that 30% of Social Security to the 45% that you have already saved. So you've got 75% of an annual income during retirement. So it's a great goal to start with. Now, most people assume that they would be living on less income during retirement. And to make that happen, you'll need to set yourself up by setting some goals and asking yourself certain questions. Things like, you'll want to make sure that your mortgage and credit cards are being paid off. If these are paid off, this will give you confidence in your budgeting during retirement. Not supporting any unnecessary dependence. This could mean an uncomfortable conversation ahead of time, but these types of boundaries need to be set. Okay, being in relatively good health. It's a good idea to take an honest inventory of your health and your lifestyle needs so that you can prepare for what kind of expenses you're going to have during retirement. And then having an emergency fund or savings available. You'll have much more peace of mind if you have a nest egg to rely on during retirement. And this nest egg is for emergencies. We're not talking about your 401k plan. Your 401k is meant to be your retirement savings in general that you use to supplement things like your Social Security or pension or things like that. That's what that's for. So we're talking about an actual emergency fund. And an emergency fund should be at least 3 to 6 months of your annual salary. So that is your basis for your emergency fund. Most households have typical spending habits, and they decrease over time. Learning to control your spending habits earlier in life will give you a huge advantage during retirement. There are some things that you can count on that they will not decrease, and that is healthcare spending and housing costs. These are things that should be prepared and planned for. All right, when we talk about income during retirement, you'll notice that the main theme is planning ahead. Managing upcoming risks and planning for those risks is a big part of retirement income. Risks like longevity risk or market risk, inflation risk, healthcare risk, debt carryover. Many of these risks can be subdued or even avoided with adequate planning, but the opposite is also true. If you haven't planned for them, any one of these can be catastrophic during retirement, can really have an impact on your well-being and your lifestyle. Now, people are living longer these days, and this means that we'll have to support ourselves for a longer time during retirement. So this is a longer period. Men who live to 65, they actually have a life expectancy of up to 84. Women who live to 65, theirs is up to 86 and a half. And about 1 out of every 3 65-year-olds today will live past the age of 90, and about 1 out of 7 will live up to 95. So that's a long time. If you retire at 64 or 65 and you live till 95, that's 30 years you have to provide for yourself during retirement. That's a long time. For a lot of us, that's how long we actually worked. So if you weren't saving all that time, that's a really long time to be paying for living expenses. Now, there are multiple points to consider when you think about a retirement income and how for yourself, how you're going to provide for yourself and maybe a loved one. How much money will you spend for needs versus wants versus medical expenses? How will the market hold up during the time while you are withdrawing from your assets? What will the inflation percentage average during your retirement time? Longevity. Again, for couples that are age 65 and older, there is a 25% probability that one of you is going to live to around 95, 96 years old. Is your savings enough? Are there any gaps that you need to worry about? These are questions you need to be asking yourself as you approach retirement. And long before then, you should be asking these questions in your 30s and 40s and 50s so that you're preparing ahead of time. Because retirement seems like a long ways away, Most people don't start to really consider the factors until they get much closer than they should be. Creating a plan of action can give you confidence when you're entering into retirement. Consider ahead of time what sources you will have for income during retirement. Look at some of the reoccurring expenses that you'll have and plan for them. Try to plan for emergency needs or big ticket expenditures that will come up. Now, these are strong points to consider, and if you have questions about them, again, please reach out to CAPTRUST. The number is 800-967-9948. And if you do have questions right now, I know that Ricky's going to be trying to answer some of those questions while we're going through this, because we do have a lot of stuff to cover today, and there's a probability that we may actually not get to questions. So please be putting those questions in the question section of the dashboard. All right, we've talked a little bit about how most people assume that they'll be living on a lesser income during retirement, and it's a good idea to look at some of the essential expenses and versus the discretionary expenses that you deal with now while you're working, and then compare those to what you assume you will be what will be the situation during retirement. So you just want to look at what you're spending right now with the essential stuff and the discretionary stuff. Look at that and then compare to what you think that's going to be in retirement. Give yourself a heads up. This can give you a reasonable idea of what your income will need to be so that you can plan for it. If you don't do this, you just are leaving yourself in a giant question mark status. There's a giant unknown. And all that's doing is adding unneeded pressure. Again, I highly recommend you go through these numbers and then reach out to CAPTRUST and let's talk about creating a budget and making sure that you are set up so that you know how much you'll need each year during retirement and how much your income sources are going to provide so that you have an idea of what that picture is going to look like. You want to do this ahead of time. All right, a comparison like this really can make it a lot easier to estimate your monthly and annual expenses. So please do that ahead of time. All right, one strategy for handling different types of expenses is to match the different types of income to those expenses. So for example, lifetime income sources such as Social Security and pensions, those can be matched up to your essential expenses. Things like food, clothing, shelter, healthcare, utilities, transportation, taxes. Those lifetime income sources like Social Security and pension and things like that, those can be matched up to those expenses and it gives you an idea of where you stand. If your lifetime income sources are not adequate to cover your essential needs, you'll need to determine how much monthly of annual withdrawal you'll need to take from retirement plans like IRAs or other savings that you may have like 401ks, 403bs, things like that. It is important to understand how to meet these expenses while you're juggling to make your money last. This isn't a process you want to start when you are 65. This is a process you want to go through in your late 50s. You want to be ready for this and know exactly how you're going to pay for it. Again, planning is the theme here. Once you have that gap under control, that will help you determine what you have for discretionary spending on things like entertainment or travel or memberships to clubs or whatever you want to participate in. So just keep in mind, discretionary comes after essential, obviously, but you're not going to know what you're going to be able to do unless you have done a good job of measuring these expenses and your income sources as you have them. If you have created a variety of different ways of accumulating money, such as retirement plans, real estate investments, IRAs, personal savings and investments, you may also want to seek advice about tax implications on those distributions, because these types of distributions have differing tax liabilities. And so you want to make sure that you are aware of what your taxation situation is going to be during retirement. A few tax events you should become familiar with are things like Roth distributions. These are tax-free if you meet the required criteria. Capital gains and dividends. These are taxed as investment income. Ordinary income. These are distributions from retirement plans like your employer plan, like a 401k or 403b. Those are taxed as ordinary income, just like your income tax is now. Social Security, remember, provisional income received alongside Social Security can cause your benefit to be subject to taxation. So again, The idea there is that if you are taking Social Security and you have some other type of income, that other type of income can have different ways of being taxed. So you want to make sure you understand the taxation around it. Rental income, properties that produce income will be taxed on a different rate. Another consideration that becomes very important during retirement are required minimum distributions. This is one that most people are looking forward to us talking about. These are some of the points that you should be aware of when you're talking about RMDs, or required minimum distributions. There are some exemptions to that if you are still working. So let's see. So first, you must start receiving the payments from tax-deferred vehicles by April 1st of the year following the year you turn 72. So I want to clarify. So let's say that this year you turn 72 in August. Okay, so then next year on April 1st, that is when your first payment from a plan would be required. So you'd have to take a distribution by April 1st of next year if you turned 72 this year. Okay, and again, there are some exemptions to this. Make sure that you plan ahead of time so that you're starting to take these and you don't incur penalties. You absolutely can get a penalty from this, so you want to be ahead of it. You don't want to wait. I remember years ago when I was just getting started in this industry, I had a guy call up, and he called us on, I believe it was like March 30th, or it was right at the end. It was right before April. And he said, I'm in trouble. I didn't know I had to do this. I turned 72 last year. I just found out that I have to do that this year. I thought it was the next year. And he was freaking out, and he had all this angst in his voice. And he ended up incurring a penalty because we could not get that distribution out fast enough for him. You don't want to be in that position. Again, planning is the key. If you don't take these, it can result in a 50% penalty by the IRS. That hurts quite a bit. Some accounts like IRAs can typically be added together to calculate a single payment. So IRAs usually can be an aggregate total of a single payment. Other accounts like 401ks, 403bs, 401as, 457bs, those type of workplace accounts, they cannot be added together, and you must receive a payment from each account. Those are the most typical accounts. So just want to reiterate, if you're working with a retirement plan that comes from your employer, like a 401k, if you have multiple of those, you might have some from previous employers. Make sure you understand you have to take a required minimum distribution yearly from each of those plans. Okay, another advantage to Roth IRAs is they are exempt from RMDs. You do not have to take a required minimum distribution from a Roth IRA. All right, now like anything else, if you wait until the last moment, it will cause unnecessary stress and worry. There is a very specific timeline that needs to be adhered to during retirement at different stages, and it's best that you know where you fit and what to be prepared for at those stages. If you're 50 years old and do not know when you plan to retire, it's best to sit down, think it through, and come up with a plan. Knowing that you have 12 years until you plan to retire gives you peace of mind if you feel that you still need time to save. So on the contrary, being 59 years old and still hoping that you can retire at 63 when you haven't evaluated your savings provides a lot of stress. The recommendation is to sit down, look at your time frame, compare your savings to your expectations for retirement, and do an evaluation. This is another one of those strong points where we encourage you to reach out to CAPTRUST so we can help you evaluate your circumstances and help you come up with a plan. So let's look at investing and asset allocation and how you can use that to prepare for retirement. Asset allocation is critical when we're looking at protecting our assets for long term. The idea is to spread your money across the different asset classes so that no one asset class is so dominant that it can have too much of an effect on your overall portfolio. So to repeat that, you basically want to spread your money across all the asset classes so that not just one of these can have such a big impact that it hurts your entire overall portfolio. Okay. Historically, stocks have significantly outperformed most major asset classes, and this chart gives us the average returns for the three major asset classes as they compare to inflation. Inflation is on the right there. This time period is very poignant for us right now because what we're going through in the market, it includes a number of economic recessions and the Great Depression. Stocks have posted a greater return than bond or cash type investments during this time, and bond investments have outpaced cash type investments. As mentioned before, though, cash-like investments typically have had the lowest returns due to their more conservative nature, and they barely have beat out inflation. So you want to be outpacing inflation. Understanding inflation is an important aspect when you're considering of how to invest. Again, the cost of goods and services continues to increase over time. So it's important that our investments earn at least a return that is at least equal to that of inflation. But of course, the idea is that you want to be outpacing it. And the risk associated with not keeping up with inflation is the loss of purchasing power during retirement. This just means that you run out of money too early during retirement because your money didn't keep up with that of inflation. Okay, so when you are considering investment types, there are three key factors. The first is your goals. What are your financial goals? How much will you need to accomplish them? Knowing how much you need to save for retirement can greatly impact your investment decisions. So if you're wanting to travel or have vacation homes or something like that, you're going to need to save more money. How much time do you have until you need the money? If you've got a long time horizon between now and when you expect to start withdrawing from your retirement funds, then you can afford to be more aggressive in your investments. If that time is closely approaching, then of course you would want to be a lot more conservative in your approach. The last factor is how much risk you are comfortable with, or what we call risk tolerance. If you're an aggressive investor, you'll have a greater percentage of assets invested in stock funds, whereas a conservative investor would have more invested in bonds and would need to save more because of their conservative nature of their investments. Okay, again, there's a lot more that we can cover in just this short time, so please reach out to CAPTRUST so we can go over it with you and make sure that you understand. Now, there are several risks to consider when it comes to investing. It's important to understand how age can play such an important role in your planning for retirement. Those in their 30s can handle more risk and volatility than someone who's in their 50s or 60s. Later in life, you're going to want to protect your assets by investing more conservatively. Understanding the mathematics of loss will help you understand your time frame for savings. If you had $1 million portfolio that lost 50% in 1 year and then gained only 50% of that back the next year, you're still down $250,000. To get back to even, you'll need another $250,000, and it may take time to recover that. The loss isn't just the money, it's the time the money will take to recover and the lost time of what you didn't earn. It's important to have reasonable expectations for our investment returns. We're always hoping for higher returns, but there are averages that are much more probable that you should be expecting. Remember, long-term average stock market returns usually average around the 10% range. Having a reasonable outlook helps us set and maintain realistic goals. Okay, as we start to wrap up, let's talk about your next steps. It's time to start right now. If you have not been saving in your middle of the road in your work time frame, start saving immediately. Get set up as soon as you can. Take a moment to think about how much you will need to reach your retirement goals and then start saving. Then choose your investments based on some of those things we've talked about today. But remember, CAPTRUST can help you. There's a lot that we covered today. Medicare, HSAs, all these things, there's just so much to cover. And it isn't that we've scratched the surface, but we've introduced you to a lot of concepts, and you could have a lot of questions, especially that pertain to your specific circumstances. So please contact CAPTRUST so that we can help you get started planning for this and be ready for it when the time comes. All right, I want to make sure that you have the information you need for the different parties that are involved here. First of all, make sure that you are familiar with our website. Go to captrustadvice.com. You can set up an appointment to talk to us there, or you can call the advice desk directly, again at 800-967-9948. You can call that advice line Monday through Thursday, 8:30 a.m. to 5:30 p.m. Eastern, or on Fridays from 8:30 a.m. to 4 p.m. Eastern. And then the appointment times, though, they do go later in the evening, and that's so that if you want to involve a partner or spouse in the conversation, we highly recommend that. So Monday through Thursday, the appointments go up until 8 p.m. Eastern time, and then on Fridays they go up until 6 p.m. Eastern time. So CAPTRUST offers you independent investment advice and has nothing to sell you. You can set up as many appointments as you like. It doesn't cost you anything. We want to help you be more confident with your financial future and answer any questions you have. We are 100% fiduciary. This means that we do not have an agenda and nothing to sell you. We couldn't sell you anything even if we wanted to. That sale has already happened. So this is bought and paid for. Please reach out to us so we can help go through any questions that you might have. And then remember, as a reminder, CAPTRUST is holding the virtual one-on-ones on May 9th, 10th, and 11th. If you look in the chat section of your dashboard, you'll find that link, and you can use that to set up the appointment time with one of our advisors, or you can use the handout that is in the handout section of the dashboard. You can download that scheduler and use it to set up an appointment. And of course, if you're not available or you can't use one of those appointment times, they don't work for you, feel free to just set up an appointment with us here at CAPTRUST. Okay, we are at the hour exactly, and so I guess it's time to wrap up. I'll go ahead and turn it over to you, Ricky.
Thank you so much, Spencer. I truly appreciate all that invaluable information that you presented to all of us today. I know a lot of you have been asking questions in our question box, but if you didn't have a question at this very moment and you're not quite sure what to ask, you may have to absorb the information a little bit to really know the right questions that you have. If that's something that resonates with you, I definitely suggest contacting our advice desk at 800-967-9948. We're available to speak to directly Monday through Thursdays from 8:30 a.m. to 5:30 p.m. Eastern Standard Times, and again on Fridays from 8:30 a.m. to 4 p.m. Eastern Standard Time. There is also evening appointments available, so you can schedule those. The link and the phone number is in our chat section of the dashboard. And again, just to reiterate, there are those specified virtual one-on-one days. Those spots, since we started this presentation, are filling up very quickly. So I'm excited that you are taking advantage of that service we have here. Please make sure to click the link in the chat box, and you can have an appointment that's scheduled specified for your own company, but we're always going to give you the same service that if you just call in or just set an appointment, as well as the virtual days. So don't feel worried if you're not able to make the virtual day. The time doesn't work for everyone, and we understand that. Please be advised also, spouses and partners can come to these meetings that you have, so make sure to include them. You're doing your retirement planning journey together, right? Thank you again for joining us, and I hope everyone has a great rest of your day.